Welcome to your weight loss surgery journey. You're preparing to have weight loss surgery. It may be 6 months or 2 weeks until surgery, or maybe you just had your first consultation. Most of what you've been researching, learning about, and talking about is the surgery itself and how it can improve your health, the risks, the benefits, and this is all great. Yet another very important factor in weight loss surgery is the mental component or the emotional component. Understanding how this plays a role in your long-term weight control is critical to your long-term success. At first glance, these statements may seem a little extreme. But when you're around 100 pounds or more overweight and you've been feeling like your weight is a trap, that it's holding you back, you may have had a similar thought. If only I could lose this weight, I would, well, you fill in the blank. So did you fill in the blank? You probably have said something like this to yourself. Winning the lottery is really a metaphor for what being slender could mean for you. So here's the reality. When you're healthier, your life can improve. Medical conditions can improve, and you could be taking less or even no medication. That would make you feel better. When you have less weight to carry around, you could have more energy and be able to do more. Not just more work, but more fun, and that can make your life better. For many people, when they are feeling better about themselves, their relationships do improve. So yes, your quality of life can improve after weight loss surgery. Multiple studies over the past 10 years undoubtedly demonstrate that the vast majority of weight loss surgery patients lead more fulfilled lives. And these improvements are long-lasting, according to the past decade's research. The level of success and improvements in your quality of life is equal to the amount of effort and commitment you make to lifestyle management, nutrition, exercise, vitamins, and medical follow-up. And it is critical. If there are issues in your life right now that are a result of a difficult childhood experience or a trauma in your life, you need to get help for this now. Group therapy or individual counseling are important steps to take before surgery. Weight loss surgery is an amazing tool for controlling your weight, but it's all up to you. By now, you may have thought about how much weight you really want to lose, and you may have thought about how much you think you'll really lose, and your numbers may be different. Now, one reason may be because you spoke to your surgeon and he or she told you about the average percentage for the procedure that you've chosen. But here's the thing. If you are thinking that you may not lose the average amount expected for your procedure, why is that? Do you doubt yourself? Do you feel like since you failed at other weight loss methods, you might fail at this too? Or do you feel that even though it's worked for thousands of other people, it may not work for you? Okay, those thoughts are all normal. Here's the thing. The surgery works, but only to the extent that you make it work. How do you know you're ready to make lifestyle changes? Why is now different than 2 years ago or 5 years ago? How do you know that this time you're really ready? Weight loss surgery needs your commitment, not just after surgery, but right now. What have you committed to? Since your initial weight loss surgery consultation, what changes have you made? What changes have you made with your eating? Have you eliminated soda, alcohol, cookies, chips, and other snacks? Are you consuming at least 2 protein shakes each day? And do you know how much protein, carbohydrates, and sugars are in each serving? Have you found a way to start moving or ways to exercise more? Have you started to pay more attention to your hunger cues so that you eat only when you're really hungry and not because of stress or loneliness or boredom? Are you doing any of these? If you're telling yourself, no, that's not me, go through the list again. Are you sure? What do you want food to do in your life? What role should it have? And how is the new role of food different from your current relationship with food? Now, write this down. If you have limitations because of your medical conditions, have you talked with your doctor to see what you can do? If you don't have limitations, but you're not exercising yet, what's stopping you? What have you felt about exercise in the past? And what has stopped you from committing to exercise in the past? How do you feel about it right now? Be honest about how you feel about exercise and what you're willing to commit to. What you are really willing to commit to, knowing that without exercise, you will not achieve the full success of the surgery. And long-term weight control without consistent exercise is almost impossible to maintain. So what is your real exercise plan? Write it down. Life is busy and filled with expected and unexpected stress. What skills do you have right now to deal with stress? When do you use food right now to cope? If you're feeling bad in a relationship, do you find yourself eating to take away the stress of it? If you aren't getting enough sleep, do you use food when you're really just tired? Do you make time for fun, time to enjoy yourself? And if you don't, why aren't you? Take time and think about your life. And when you're eating, but not really hungry, these are the things that need to be addressed before surgery. Write down your plan. Do you imagine that when you are slimmer and healthier, all of your relationships will just be better? Statistically, the marriage relationship after weight loss surgery only improves if it was already pretty good before the surgery. With your friends and family, you may see some great reactions to your weight loss, along with loving care and support. And sometimes you may not. Being realistic about your expectations is important. So what have you written down so far? You have written something down, right? Your weight loss surgery plan is important. The time you took to research bariatric surgery and the procedure you're having and the surgeon you chose to do it, they're all important. But your plan is important too. Write it down. Healthy, good support is critical before and after weight loss surgery, so you are encouraged to have someone to support you through this journey. It's important for you to take your time and really think about who could be the best person. And it's not always the most obvious person. Take time to think about this choice carefully. Years ago, patients may not have been as open as they are today about having weight loss surgery. Thankfully, weight loss surgery has become more mainstream, and with that, people are more comfortable telling family, friends, and coworkers that they are having or had weight loss surgery. But you'll tell people when you're ready, if you feel they should know. It's important to sit down and talk with your spouse or partner more than once. Weight loss surgery changes your life forever, and as a result, your partner's life. What is he most worried could happen during surgery? What is she most worried could happen after surgery? Is he concerned that even though he's not ready, he'll be forced to make changes in the way he eats just because you had surgery? Or is she convinced you're starting a new life and leaving her behind? These are things you need to sit down and talk about. Most importantly, if there are issues between you and your partner now, weight loss surgery does not usually make them better. It is highly recommended. If there are issues now, seek counseling before surgery. This is very important. Once you have all the parts of your plan written down, sit down and talk about it. The people who love you and care about you most need to understand what all of this means to you and to them. So what's the bottom line? Simply stated, weight loss surgery is a big deal. It has the potential to do incredible things for your health and for your life, but only to the extent that you put in the effort. Weight loss surgery is by no means the easy way out. It's far from it. There is a lot to do before surgery: lab work, cardiac scans, specialist consultations. But really, these are almost the simplest things to do. It's the things that you have made into habits for years that are harder to work on and to change. But these things really matter and can make all the difference in achieving your weight loss surgery success.